Talking a little bit about stroke now. Dr. Martinson Arnan with the Bronson Neuroscience Center joins us on the phone. Good morning, Dr. Arnan. It's nice to have you with us.
Good morning. Thank you very much for having me.
Just a little bit about stroke. It is a very scary thing. We talked about the Zika virus with one of your colleagues earlier, but, stroke, something that could happen to everyone, and we see the results that can be so horrifying where a person's just not able to function anywhere near the level that they had. What exactly happens when someone has a stroke?
Well, the brain lives on blood. Blood carries oxygen and the energy that the brain needs. If anything blocks blood flow to any part of the brain would immediately, at least the part of the brain that is deprived of blood, will start to die. That's what we call a stroke.
And that's not reversible. Once a portion of the brain is deprived long enough, it's not going to come back.
That's exactly right. The part of the brain that dies cannot be recovered. So the goal of stroke treatment is to decrease the amount of brain that dies. That's the way we prevent people from having a lot of disability from their stroke. The other thing is that if you get the right treatment, the brain has this ability that we call plasticity, which means that it can be trained to allow a person to recover some of their function even after they've had a stroke.
Is it sort of like portions of the brain that normally might not perform a certain function step up to the plate and kind of take over?
That's exactly right. That's what we think happens, that there are different parts of the brain that might be either close to the part that died or that might have some network connections to to another part of the brain, and sometimes they can be trained with speech therapy, physical therapy, occupational therapy to start to do some of the things that the parts of the brain that died used to do.
Most important thing, what are the signs, what are the symptoms of a stroke? We might see it in a colleague or a family member, and we can help them take the fast action needed to prevent a catastrophic stroke. What do we look for?
Well, it's very, very easy to recognize the signs of a stroke. And usually a person would suddenly have a problem with their face becoming, one side of their face becoming droopy. Or you might notice that your loved one suddenly cannot move their arm or a leg. Sometimes people will also have problems with their speech, where they might not be able to speak clearly or even express themselves. If you see any of these things, we need you to act fast. You need to call 911 because we have well-trained EMS teams that can come to where you are and bring you to the nearest hospital, such as Bronson Battle Creek, for you to get the treatment you need as soon as possible.
And what will they do if a stroke patient comes to the emergency room and they're exhibiting the symptoms? What do they do right away?
So right away, when you come into the emergency room, you are evaluated by the ED team as well as the neurologist, and they determine that it's safe, if it's safe to give you a clot buster medicine. So within the first up to 4.5 hours after a stroke, we get to give you a clot buster medicine called TPA that can decrease the chance of you having a bad disability by 1 in 3. And so it's very important to get to the hospital as soon as possible for you to receive that medicine.
Are we doing better than we used to as far as preventing, treating people with stroke? I mean, is it the prognosis better than it used to be?
I think that it continues to improve. Thankfully, we've recently found out that even if some people don't get the clot buster medicine on time, or even if they do, sometimes the clot is so big, the clot buster medicine is not able to dissolve all the clot. And so in special places such as comprehensive stroke centers, and we're thankful in this community that Bronson has a comprehensive stroke center, or is a comprehensive stroke center, which I direct. We have the specific skill set with neurosurgery intervention to go into the brain after the clot and take it out with remarkable results often.
What are some of the main things we can do to prevent stroke?
Well, the things that your doctors have always told you to pay attention to in terms of things that improve one's health are the same things that prevent one from having a stroke. So if one is identified to have hypertension, you absolutely have to take your medicines as prescribed to keep the blood pressure well controlled. Things like smoking certainly continue to be a big risk factor for stroke. We also have to make sure that our glucose is well controlled. And so if a person is on the borderline of having diabetes, they have to make sure that their diet is healthy enough not to cause their sugar to rise too high. We are thankful also that with people who have high cholesterol, we have recommendations about how they can eat better and medicines that can help as well.
Dr. Martinson Arnan of Bronson Neuroscience Center, we really appreciate you giving us some great information today about stroke and stroke prevention, and we look forward to talking to you again soon.
Excellent. Thank you so much for having me.
And coming up, we have got a chance.